Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Wednesday, May the 20th. This month is flying by. My name's John Bradford. I am your series briefing call moderator. We are in the middle of week 9. We've been doing this every Monday, Wednesday, Fridays. I'm a business owner, 2 businesses right here in North Mecklenburg, also a former member of the North Carolina House of Representatives. And I just wanted to share on your screen, both my companies just hired 2 new people even during the pandemic. So there are some companies that are hiring, so there is some hope there. And it's a real privilege to be able to continue to be a job creator right here in North Mecklenburg. And so I just wanted to share that with all of you. The purpose of these calls is to bring together healthcare experts, government officials, business leaders to provide COVID-19 briefings to help update, educate, and support the North Mecklenburg region during the outbreak. There's still guidance available from the CDC on cleaning and disinfecting public workspaces, businesses, schools, and homes. So develop your plan, implement your plan, and then maintain and revise. The current count for the U.S., we're just over 1.5 million total cases, 90,000 deaths. That's up 900 deaths from yesterday. Since our last call, the number of deaths was 88,000. So, you know, the number is still climbing, but it does look like it seems to be slowing down, which is promising. The heat map, as you can see, North Carolina is about middle of the pack compared to other states. So just wanted to share that with you. FEMA has a rumor control website. No new rumors. Haven't been any new rumors for a couple of weeks now, but I encourage you to check here. Important thing is if someone's trying to get your personal information to send you money, chances are you're being scammed. So please be careful. We're still under a state of emergency in North Carolina. The latest numbers from the North Carolina Department of Health and Human Services, we're at 691 deaths. 585 currently hospitalized. Comparing that to our last call on Monday, we were at 661 deaths, and there were 511 hospitalized. And on Monday, there were 99 counties impacted, and we now have a case in that last county. So we have 100 out of 100 counties impacted, not terribly unexpected. We knew that was coming. And I have a little arrow here showing you where Mecklenburg County is. And you can see the urban areas are the more darker blue on this heat map, which again, because of population density, is not terribly surprising. We are still in phase 1. The stay-at-home executive order is in place through phase 1. Phase 1 is tentatively scheduled to expire Friday, May 22nd at 5 p.m. If that still happens, that means we're going to go into phase 2. That means the stay-at-home executive order will be lifted, although there'll be strong encouragement for vulnerable populations to continue to stay home. It will allow limited opening of restaurants, bars, and other businesses that can follow strict safety protocols. It will also increase number of people at gatherings. It'll open some public playgrounds, etc. Now, we're going to talk a lot about restaurants today because I know everyone is itching to go out and have a meal, including myself. There are new guidelines that were just issued by the Department of Health and Human Services for restaurants in phase 2. So it's 5 pages long. A lot of these things are recommendations. I'm going to cover the requirements. There are some requirements for restaurants, and I just feel like it's noteworthy to talk about those on today's call. So in phase 2, assuming we hopefully start on Friday at 5 p.m., restaurants are required to social distance and minimize exposure by making sure tables and seating achieve a 6-foot separation between parties, both indoor and outdoor dining. That includes out on patios. Each group of people sitting at a counter should be separated by 6 feet. So if there's any type of counter service, 6 feet separation. No more than 50% of the maximum occupancy as stated in the fire capacity will be allowed. So 50% capacity. And if a restaurant does not have a fire code number available, you may permit up to 12 people per 1,000 heated square feet. So there's a formula there. Restaurants need to post the reduced emergency maximum capacity in a very conspicuous or obvious place. And signage should be posted about social distancing, asking everyone to stay 6 feet away from others, and then also mark 6 feet of spacing in high traffic areas, such as at the cash register or anywhere where customers may be waited, like in a waiting room, to be seated. Now that was for social distancing and to help minimize exposure. Restaurants are also required to help keep clean and practice hygiene. That means perform ongoing and routine environmental cleaning and disinfection of high-touch areas like doors and doorknobs and rails using an EPA-approved disinfectant. And then they must increase disinfection times, the times of cleaning during peak times or high customer density. And that also includes menus and countertops and condiment holders, receipt trays, anything in between use of customers. The disinfectant of dining tables and booths and reusable menus between use. And also that disinfectant needs to sit for the required sitting time recommended by the manufacturer to do its job to kill any of the germs, if you will. And then they need to promote frequent use of hand washing and hand sanitizer for the wait and food service upon reporting to work and throughout their shift. Hand washing is required to meet the requirements as specified in the North Carolina Food Code Manual. The other thing they need to do is they're required to monitor for symptoms, and this is monitoring employees and customers. So there's three things they need to do. They have to conduct daily symptom screening with a provided questionnaire. It's an interview questionnaire provided by DHHS of their employees immediately upon them getting there. And if there's anyone that's symptomatic, they need to send them home to isolate. They need to the restaurant has to post signage at the main entrance requesting that any customers who have been symptomatic with a fever and or cough are not allowed to enter. And there's a Know Your W's flyer and Stop If You Have Symptoms flyers. Those should also be posted at the restaurant. And then the last thing that's required is employees who have symptoms when they arrive at work or become sick during the day should immediately be separated from other employees and any customers and visitors and sent home. So those are the requirements for restaurants. And there's a lot of other recommendations, but the requirements are what I want to cover. After phase 2, which is supposed to last 4 to 6 weeks, which will get us through about June 19th, July 3rd, we'll move into phase 3. We'll cover phase 3 more when we get there, but the restaurant thing is a big issue. Now, the 3 W's: wear a face covering, wait 6 feet apart from each other, and wash your hands. Those are the 3 W's. I was contacted by a company yesterday, another North Carolina-based company out of Kinston, but there's a Cornelius connection. They have a person in Cornelius that I guess is a company sales rep, but they sell thermoplastic nylon face shields. And I think you've seen some face shields. I've seen people wearing them at Lowe's. So if you're a restaurant and you want face shields for your workers, you can order these for $8 a piece, which seems very affordable to me. They're thermoplastic nylon. They meet the certifications, and you can wipe them down. It's a transparent shield, anti-fog. You can see right here on the screen. It's called layered manufacturing. They're using 3D printers to make these. They usually do something else, but they turn their lines into making these frames and shields. So $8 a piece, you can go right here and order them. And if you need face coverings that are cotton, you can still go to Indira Mills, shop.indira Mills, and get those for $2 a piece. Youth and adult sizes are available. Mecklenburg County, we have 2,646 cases, 68 deaths. That's up from 64 on Monday. And we have 68 folks who are hospitalized right now in the county. It is important, though, that all those deaths, those 68 deaths, all of them were above 60 years old, except 4 of them were between 50 and 59. And all deaths occurred in those adults with underlying chronic illnesses, and more than half are attributed to active outbreaks at long-term care facilities. I think the message here is, yes, there are deaths, and one death is one too many, but they are definitely helping in a more senior, vulnerable population. And that's something to keep in mind as we get into phase 2. If you feel like you're vulnerable, stay home. You'll have that choice. Now, we're going to move to our panelists. I don't know if we're lucky enough to have Congressman Greg Murphy with us today. He's been in and out of OR all morning. Dr. Murphy, Congressman, are you with us today?
I am. Can you hear me?
Oh, yay. Thank you so much, sir. Tell us what's going on in the health community and maybe in D.C.
Well, John, thank you again for doing these. These are very, very good, and I appreciate being invited to be part of them. We're not in D.C. at the moment. We came last week and had a very difficult kind of condition there, but that's moving forward. You know, what we're seeing now is over 36 million people in the country have filed for unemployment. And this is obviously devastating, 900,000 of which are in North Carolina. You know, the data, as we look at it, has shown that we're getting more positive tests, and people have been alarmed about that. But let me caution, that's totally understandable, totally expected. As we test more, we are going to get more positive tests. But what is really good, the best statistic, is that the percentage of individuals who are testing positive has gone down tremendously. 3 weeks ago, it was about 15%. Now it's about 5%. Hospitalizations across the state have stayed stable, and that I believe is really the key statistic. Is you know, we flattened the curve not to just save lives. We allowed it to, so we did not overwhelm our hospitals. Our hospitals are in very good shape now, not perfect, but a lot better than they were before. And we are not going to see people, we are going to see people infected with COVID-19 in the hospital for many, many months to come. So I think it's unrealistic for people to think that this is magically going to go away. As we move forward, and the statistics clearly show that we can move forward, we do so in a responsible manner as we open up restaurants, as we open up beauty salons and barber shops, those places, churches. Just plead with individuals that continue to do things that have made a difference. That means social distancing. That means wearing masks when appropriate, doing the right things. And I think our people will. I think they've gotten the message. We will have people being hospitalized, and unfortunately, we will have deaths. But as you pointed out, there is a critical population that is much more prone to have a bad outcome with this virus. Those are the people that need to be sheltered in place. Those are the people that need to be taken care of mostly. But, you know, at this point, we cannot stop living. We must continue to try to embrace the situation as it is, deal with it as it is, and move forward. So I thank you again for the education that you're providing to the community. It is a very welcomed resource, and thank you for the time to be on your show.
Yeah, thank you so much, Congressman and Doctor at the same time. Thanks for putting North Carolina, our country, first, and also all your colleagues and frontline healthcare workers. We appreciate all of you. Moving to every Wednesday, well, this has just been a fantastic group of panelists, and every Wednesday we've been joined by the United States Small Business Administration, the Director of North Carolina, Thomas Stith III. He's been a mainstay. He's with us today to give us an update of what's going on there. Director Stith, the microphone's yours.
John, thank you again. I appreciate the opportunity to join you and to share continuing good information with the listeners. First and foremost, I would like to talk about the Paycheck Protection Program. As we know, that went through a second round of funding of $310 billion. There is still funding available in the Paycheck Protection Program. The number clearly each day is changing, but it's safe to say at this point still over $100 billion. It's $100 billion still available, a little over that as of close of the day on yesterday. So I encourage small businesses, nonprofits, faith-based organizations, if they feel that that would be a viable financial tool for them to assist in providing payroll payments for their employees, and a specific amount can be used for general operating expenses of utilities, rent, lease payments, mortgage interest, to still work with your lending institution, whether it's your bank or credit union. We do have a broadening list on our district office website with North Carolina banks that are participating in the PPP. Also, fintech companies such as PayPal, Intuit, Cabbage, those are working now with SBA. So if there's a smaller business or nonprofit that doesn't have a banking relationship, we have those resources available. As of May the 16th, the latest numbers nationally, over 4.3 million paycheck protection loans had been approved. That's including first and second round. And that comes to a little over $513 billion. So a significant amount of financial assistance into our economy. Here in North Carolina, a little over 109,000 paycheck protection applications have been approved. And that's a little over $12 billion, about $12.3 billion. We're seeing a smaller average loan size than the first round, and that was a strategic between Congress, Treasury, and SBA to ensure our smaller businesses had access to capital. So at this point, the average loan is about $118,000. In the first round, you may remember it was around 207,000. So significant reduction in the average loan size. And we're seeing a good distribution now with the Paycheck Protection Program, with the size of banks. Our under banks that have under 10 billion in assets compose 43% of the loans. The larger banks over 50 billion are 37% of the loans, and our mid-sized 10 billion to 50 billion of about 19% of the loans. So again, we feel some of the lessons learned from first round certainly coming into play in the second round to provide a broader amount of diversity in the loans. And also do want to mention the economic injury disaster loans. As I mentioned, I believe on last week, that agriculture businesses are now eligible. The portal with SBA is open for agriculture businesses. To date, we have about 6,500 EIDL loans that have been approved in North Carolina. The value on those are over $620 million. So again, another viable economic financial tool rather that is helping small businesses, nonprofits, and now our agriculture community as well. So John, again, thank you for the opportunity to share this information. Encourage if individual small businesses or nonprofits or faith-based organizations feel that the Paycheck Protection Program will be of benefit. There's significant amount of funding remaining, and encourage those entities to review it and potentially pursue that as a vehicle to support their small business. Thank you, John.
Wonderful. Wonderful. Thank you, Director Stith. That was a fabulous update. And again, thank you for joining our calls every Wednesday. It's been most helpful. I've heard from a lot of folks specifically talking about your update. So thank you. Usually we're joined by Dr. Jack, but even Dr. Jack's got to work. So today, Dr. Jack is unfortunately tied up doing what he does, and that is taking care of people's health in our area. So he texted me and said he was with patients. So now we're going to go to Mecklenburg County Commissioner Pat Qasim to hear an update about the county. Commissioner Qasim, are you there today?
Yes, I'm here.
There you are. Hi there. Welcome, welcome, and would love to hear an update from you.
Okay, well, thank you. And gosh, we had two great speakers with a lot of information. So thank you again, John, for coordinating this. I want to talk about we had a board meeting last night, and we did talk about COVID, but more on the financial side of it. One thing that was, you never know, a lot of times before we have a meeting, you know, there's something that comes up at the last minute, and this was no different. About 15 minutes before the meeting started, one of my colleagues, Commissioner Fuller, he sent out an email that he was going to, at the meeting, make a motion for a task force for COVID for the reopening process. And he wanted to set a course for rebuilding our community with public health, behavioral health, hardships by working families, employment, business, nonprofit, et cetera, et cetera. And he wanted the people to be a range of experts appointed by the county commissioners. This was just kind of a surprise. And he also wanted this to be voted on last night, and then he wanted it to have a formal proclamation at our next meeting on June the 2nd. And so this came up as we began our discussion. The manager began our discussion about COVID, and we all had to make comments about this, and I said that I was not comfortable because I couldn't really wrap my arms around what he was talking about, and I thought that, you know, as today we're going to hear from the governor, and since we're under the governor's order, it seemed to me that it would make more sense to let's see what the governor's going to do, and then, you know, we could maybe look at this down the road. And it just came up very quickly, and it seemed like some of the commissioners were aware of it. I'm just speculating. So when he started this, I thought, well, he must already have the votes. So we did vote on this, and the vote was 6-3. So of course, I was one of the no votes, so it did pass, and it's embarrassing that I can't exactly tell you what this is that passed, but it's some kind of a task force, And it just, so Commissioner Fuller will lead this, and I guess I'll learn more about this in June, but it was something that it just seemed kind of unfortunate to come up so quickly without much background. So that's the end of that topic. And let me just go to the manager talked about the funding that we're receiving. One thing that was very clear is that there's a lot of unknowns in the funding. And another thing that's important to know that none of the funds that we are receiving from the federal government can be used to replace any lost revenue. So a lot of people have asked me that, so I just wanted to put that out there first. Also, the money, there's a lot of things that are known, but there's still a lot of unknowns. And so that makes it a little tricky for the county manager, but she's an expert in finance, and she has a great finance team. We did get $39.2 million from the federal government. Now, in comparison, the city of Charlotte got like $150 million, and the airport got like $130 million. And we also received from the CDC $560,000. And we received, I just learned this last night, from the Ryan White Foundation, we received $315,000. That's to help people that are suffering with HIV/AIDS during this pandemic. So those are known dollars, but we also have some likely dollars that we will receive. And so that would be from the FEMA disaster fund. The thing is, we don't know, we think it's likely, but we don't have a clue as to how much this would be. And but we know that this money would go to help the needy families. It's called temporary assistance to needy families. But that's an unknown. There's also possible money coming from the federal government through an economic development grant. So we have known money, we have likely money, and we have possible money. So another thing that the county manager talked about is there's a tremendous compliance with this money. And it's also, she has to be very strategic. We don't want to, I mean, the county has put in our own money, but we don't want to put in money into areas where we're getting, we could get money that could be reimbursed by the federal government or not reimbursed. So it's just kind of tricky how she does the money. And they also have had to set up financial and HR systems to track staff to make sure all COVID costs are captured and documented. The context is critical to maximize potential for recovery of money and mitigate any audit risk. So those are, you know, it's just, I was glad to hear all this. I've been on the audit committee at the county since 2012, and it is important, and I feel confident that she'll do a really good job to capture all the money, because if we can't prove that it's spent in the correct way, we would have to return the money. So the goal is to not return any of the money. So she's having a lot of great compliance on it, and I know she'll do a good job on that. Right now, we have received $39 million, and we have what we have left is $20,967,000 is left. And so she was asking for, and she did give some great details on how the money has been spent, you know, pages and pages of that. So I won't go into all detail, but she certainly has that available. And I'm sure that eventually will be posted on our website. And she was asking for some direction from the board on the remaining funds. And it was just nothing concrete was about that, but more for us to think about that. And the next steps on the remaining funds, she wants us to develop options for economic development, equity, mental health, small businesses, working families, and other priorities. It is important that we have support for the whole county, and because people are suffering in different ways, businesses are suffering. So I feel like we're in a good place with the county manager leading this effort, and she's being very strategic. The only unknown part is this task force. You know, I just was I was uncomfortable with that. I made that very clear that I was uncomfortable with that last minute thing. And I don't know, I've never known a task force that didn't need a budget. So I'll just end with that. And so that's my report from Mecklenburg County.
Very good. Thank you, Commissioner Qasim, and thanks for being one of our panelists for 9 weeks of calls. Can't thank you enough. Cornelius, Mayor Woody Washam is actually out of town today. He said there were no new updates to report for the town of Cornelius. So moving to the town of Huntersville, John Annarella, Mayor John Annarella has been on all of our calls. Mayor, are you with us today? And if so, would love to hear an update from you.
I am, and if I had known that Mayor Washington wasn't going to be on the phone, I would have prepared more stuff because he usually takes up most of my time. Look, I think we have all heard the rumors that looks like the governor is going to allow us to go into phase 2 at 5 o'clock today. I'm planning a workout and maybe going to a brewery, but you may not feel comfortable doing that, and that's fine. But I know that, as I said on Monday, a lot of our businesses are preparing pretty much what the governor's restaurant guidelines have stated, and anything else that from a common sense standpoint you would think would need to be done to make their customers feel comfortable. I mean, obviously our businesses want to open with profitability, but until the customers feel comfortable, that's not going to happen. So I'm looking forward to hearing from the governor today at 5 o'clock, and then hopefully doing all the things that we've wanted to do over the last 6 or 8 weeks. We can start easing into that on Friday. In terms of anything else, I think the county has already done what Commissioner Fuller has asked. They have posted guidelines for small businesses to open, and also the precautions that they need to take. And then I know the governor is going to be coming out with a bunch of stuff today, so I'd hate to see a lot of time and energy wasted on something that's being already done. And then finally, what I'll tell you is I've signed up with Atrium to be part of their antibody study with Wake Forest. So if you're an Atrium patient of any sort, I would suggest you go to the website and sign up if you're curious, if you've had it, or if you think you might have it, or you're just curious about having the antibody. You have to answer a bunch of questions each day, and I don't know exactly when or if I will be chosen, but it's just one of those things where I think they all want to get to the bottom line of how many people have actually had this that may not have been tested, so we can feel a little more comfortable as things open up. So that's all I have, John, and I don't know how much longer we're going to be doing these calls, but I'll be here as long as you need me.
I appreciate it. Well, obviously someday we'll wind them down, and so I'm with you. I enjoy doing them, but they're a lot of work. But we'll keep pushing on until we're there. Just one thing to make a quick comment before I move on. Yes, I've heard the rumors that the phase 2 could be pulled up earlier. For the purpose of today's call, because we don't know, I'm still going to report that deadline is still tentatively Friday at 5 p.m. Obviously, if something changes, then on our next call, we would talk about that. So stay tuned to the news. Maybe that date will move forward a little bit, but as of right now, it is still 5 p.m. on Friday. But maybe today we'll learn something like Mayor Annarella said. Town of Davidson, Matthew Fort was going to join. He did send me an email, which is really his update, but then he got pulled into a meeting. So he asked me to give the update for him. They had a Town of Davidson virtual board meeting last night, and he said that what they're doing in Davidson is they're asking businesses that are supporting requiring face coverings, both for customers and employees, to please provide signage on their storefronts to better enable customers to be able to make choices to shop based on the level of safety and precautions that business owner wants. So their Davidson's website is going to be posting a list of businesses that have opted to provide these more heightened or more incremental safety protocols. He also provided an update that the town of Davidson is looking at several things they're going to be doing for like town employees. They're going to make sure town employees that are in uniform will always wear their cloth face coverings indoors when in the town of Davidson uniform. Police officers will wear face cloth coverings while conducting routine traffic stops. And then next week, they're going to be discussing costs associated with maybe adding hand sanitizing stations strategically throughout public spaces, and maybe even bringing a third-party service for local businesses that might offer thermal imaging of their employees if they choose to opt in. These are things being explored, have not been decided. And then lastly, they're also looking at options to undertake additional safety precautions at Town Hall, such as thermal imaging, mandatory face masks, having smaller handheld thermometers, and a few other things. So anyway, I just shared kind of some base highlights here and wanted to share those in Commissioner Fort's absence. No new updates from Rhonda Cheek, CMS board member, but she's been on a few of our calls. And then moving to CEO of the Lake Norman Chamber, Bill Russell, who was always first on the call and always last to talk. So Mr. Russell, the microphone is yours, sir.
John, I haven't heard anybody today give us our historical moment. What is May 20th?
Mech Day.
What is Mech Day, man? Big important day, a Mecklenburg Declaration of Independence. And I thought John Anarella would bring that up, but yeah, this is a big day for Mecklenburg County. So as I wanted to echo John's comments, yeah, I'm looking forward to, hopefully the governor's going to make those announcements later on today to where we're going to be opening up phase 2. And I've made plans for Friday at 5 o'clock in Lake Norman, if that's the case. Many of our businesses are excited about moving into phase 2. I want to remind everybody that we have the Restart LKN guide on our chamber website at lakenormanchamber.org. That's a guide that talks about the safety procedures our businesses should be exercising, making sure it's a clean environment for their employees and their customers. And that, again, Restart LKN guide is on our website. The other day I didn't mention, Commissioner Qasim brought up the stress and the concern she has of the stress of COVID-19 on families and employers in the area. We had a fantastic program last Friday where we had representatives from Atrium and Novant talk about just that issue, the stress on the families, on students, on the employers, the employees, and again, how to handle that. So that's on our website. We have a YouTube video, and if you go to lakenormanchamber.org, you can see that information. We're looking forward to our first non-virtual event in June. Hopefully, we can get back to doing some of the things that we do as a Chamber of Commerce, and one of those is networking, and we are planning for a networking event at Sam James, his funeral home, and looking forward to getting together with Sam and his staff. We will probably limit it. I think that we'll probably see some guidelines of 50 people or less, and we'll probably say, you know, the first 50 people only can attend that networking event. But we're looking forward to that as well. Plans are underway for the Lake Norman Women's Conference that will be held in August, the Chamber Expo in October. So some big events coming up on the radar. Again, most of the information relative to opening up your business safely and some of the YouTube videos that we've done, whether it be the stress or the Focus Friday that we recently had and some other events, are all on the Chamber's website, lakenormanchamber.org. And again, we're very anxious about the governor's announcement today as well. Thank you, John, and thank all the panelists for getting this information out. And we'll be touching base with our restaurateurs as well, sending out that information that came down from Raleigh that most of them already received yesterday, but we'll be sending that out as well. But thank you, everybody, for their support of small business.
Thank you so much, Bill, and your leadership at the Lake Norman Chamber of Commerce. There also is a Huntersville Chamber, and there's a website here. We've extended an open invite to them, and although while no one's ever joined in, we just want to make sure you know it's a resource for you for our area. Visit Lake Norman. This is another great resource. You can order special care packages with special messages, and they also share some local events that are being rescheduled for the fall. They have Zoom backgrounds. You can download some of Lake Norman photos and images such as docs and some of the neat things around Lake Norman, and then even some black and white coloring book type photos for any kids that may want to color a photo. So check out Visit Lake Norman, some of the great things they're doing over there at their office. Just want to thank all of our panelists and moderator. I mean, I'm John Bradford, and it's been my real privilege and honor to organize these calls, moderate these calls, schedule, record them, post them. But the real work is from all of our panelists, and we have people from all political affiliations. I've said many times, this pandemic knows no party, at least not on this call. So we have Republicans and Democrats. We're just here trying to bring real-time information and really show some leadership during a difficult time. I post these calls, record them every Monday, Wednesday, Friday. They get posted on my Twitter, John Ray Bradford, or Elect Bradford on Facebook. I post them there, so if you have an interest in following any one of those, please do so. That's where you'll get these things real time as soon as we get them posted. Our next briefing will be Friday, May 22nd. I give all my panelists a break on Friday, but because the pandemic doesn't give us a break, I still cover some information, and by then we'll know what's going on with phase 2, so that'll be an important call. You can send your emails to lkntogether@gmail. Several of you have been sending me messages on Facebook, like the Messenger, which those are welcomed also. But lkntogether@gmail.com is a great email to use. We're stronger together. Take care of yourself. Take care of each other. This does conclude today's call. Thank you for listening.